Good evening, everyone. It's so great to see so many of you joining us tonight. We invite you to say hello in the chat and let us know you're here and where you're from. I want to welcome you all and thank you for joining us today. My name is Stephanie Paul, and I am the Executive Director of MyFace. I am pleased to welcome you to our program today. This web education program is designed for families of children with craniofacial differences, caregivers, and healthcare providers. I would like to thank the Warner Fund for funding this important program and acknowledge their appreciation for the critical need to provide educational programs like this one for families of children impacted by craniofacial differences. MyFace has a long history of providing access to comprehensive medical and dental care, along with education and direct patient services, paving the way for better patient outcomes. At the heart of our approach are three pillars of support. First, our grant funding to top-level organizations across the nation. We deliver quality, comprehensive care to ensure that patients receive surgical, dental, psychosocial, speech, nutritional, and other aspects of care in a coordinated fashion. Second, through our range of direct services, MyFace aims to meet the day-to-day needs of the craniofacial community by offering support groups for affected children and families and parents, distribution of newborn care kits specifically designed for babies born with a craniofacial difference, and housing for families traveling to New York City for treatments. Finally, we strive to educate parents, patients, families, and healthcare providers through programs just like this, the Transforming Lives webinar series, and raise public awareness about craniofacial differences through our Wonder Project school assemblies and our monthly podcast, My Face, My Story, Voices from the Craniofacial Community, where individuals can share their stories, be seen, and be heard. MyFace is here to bring the craniofacial community together and help transform the lives of children and adults living with facial differences. We believe that everyone deserves a chance to thrive and live the best life possible. Now on to our program. Our presenters today are Dr. Linda D. Valino, head of the Craniofacial Outcomes Research Laboratory and senior scientist at the Center for Pediatric and Auditory Speech Sciences at Nemours Children's Health in Wilmington, Delaware. She's also the clinical professor of pediatrics at the Sidney Kimmel College, Thomas Jefferson University, and adjunct professor in the Department of Communication, Sciences, and Disorders at the University of Delaware. Joining her is Dr. Brenda Lowe, professor in the Department of Audiology and Speech-Language Pathology at East Tennessee State University and professor emeritus in the Department of Communication Pathology at the University of Pretoria in South Africa. We will also hear from Yelena Jennings. After the presentation, we will open the program for questions from participants. As you think about questions for our speakers today, please enter those into the chat on your screen during the program. It is now my pleasure to turn the presentation over to Dr. Villano.
Good evening. It's a real privilege to be here, and we're delighted. I think I speak for all of us, at least if I may. And again, thank you. I think we can move on from the disclosures. We work and we get paid for it. What can you expect this evening? Okay. What we're hoping to achieve this evening is to talk about the pathway of transition of care for the young adult with cleft lip and palate and craniofacial differences. And we're going to really present some strategies to help plan and prepare for the transition of care and even other transitions. And we were really going to learn a lot about the experiences that Elena has had in moving on. You know, life is a highway, right? And we go from infancy through, toddlers to children to teens and young adults. But that's what this looks like in the cartoon. However, it's real. It really is. And in real life, this is Elena. Elena was, this is Elena through her lifespan. And the interesting thing, picture here is her passport picture when she was adopted from Russia. And so she's had a wonderful journey with some wonderful parents. And we'll talk about that. What is transition of care? It really isn't a graduation from any place or any type of care because it doesn't end. Okay, you don't really get a diploma and say you're done. But as Elena told us very early on, that it doesn't go away. There's something that needs to be done or somebody wants something done. So we like to look at transition of care as a process. It's a process from moving from pediatric care, because we know that cleft and craniofacial differences is a lifelong experience. So we're moving from pediatric to adult-centered care, and it spans over many years. It's gradual and purposeful. We hope that it's never a sudden, and always with the patient in mind. It is absolutely patient in mind. Ideally, we would love to see it uninterrupted, coordinated, developmentally appropriate, psychosocially sound, and comprehensive. As you enter adulthood, things change. For some individuals, being 18 or 21 means goodbye to the team. But we'd like to reframe it in a way that says hello and welcome. Welcome to new services within an existing team, perhaps, or a new adult-centered team, and with some community practitioners. And we certainly welcome independence. Is transition to care discharge from care? No, it isn't. And I think it's very important to know that we don't want anybody to tell you that further treatment is unavailable after leaving the team. And maybe that's why it's not a graduation for us, but is a process of moving on. Okay. And the other thing is that services are available on an adult-centered team. They can be provided by individuals within your community. Brenda, what is the difference now between the types of care?
Okay, so thank you. And this is really important to focus on before we start working through the process. So as you all know, in our pediatric teams, team members spend a lot of time with families. You get to build great relationships with the team members. They explain things to you and parents. And like I said, there's relationships build up over very many years. And if you're under 18, then parents are involved and they have to give permission, and they're also the advocates. And then there is a very big change to adult care, which, like Linda was saying, is still person-centered. But the visits are shorter, very focused on what your specific needs are. And there is very little relationship in the beginning with a provider because it starts from anew. And, as an adult, or to use one of Elena's favorite expressions, adulting means that you have to give permission for your parents to be in the room and for medical records to be released. And I think most importantly is you're not going to be the oldest one in the waiting room anymore. So, shared concerns. We know change is difficult. Change is difficult for everybody, and especially if it's change from the known to the unknown. So there's shared concerns that we've experienced of both parents and young adults. And the first one is, where do we go? Like Linda was saying earlier, when team care comes to an end. But it's also, how do I move on from high school to college, or from college to work, or from high school to work, and new social settings in which I can be an independent adult. And it's really hard to let go, because that's the familiar and what is known to be safe and comforting. And it's very difficult for parents to, and in general, just to be able to give the children or young adults as this child support and helping them to get independent instead of being a helicopter parent, right, and hovering, being right there. And so, yes, parents and young adults can really be concerned about getting the care they want or what they need to meet their goals. For instance, is it a lip revision? Are they interested in orthodontic care or maybe more speech therapy? And then the burning question always is, how do we pay for these services? So on leaving the team, what do parents say? We did survey research and we got responses like, it came too soon. It just stopped. I wasn't ready. I had been with this team for so long. And I'm sure that resonates with parents tonight. And then what do the young adults say? So I was literally kicked from the state system. I was in college and had just turned 18. And then the doctor said, so what more do you want from me? And then the other comments were, for instance, to be honest, there really needs to be a specific group of surgeons solely based on helping adults with ongoing issues related to their clefts. No more kid office visits, no more patching up adults with what you would do to a child. That's the most frustrating. And then something that really embodies the message that we're trying to get across tonight is adults really are just now finding their own voices and realizing that 18 was not the end. When complications arise, you can find the right surgeon and speak well and with passion about the things you need help with.
So, Elena, let's hear from you. Tell us about your experiences on a cleft palate team, and how's it different now that you are an adult?
When team care stopped, I didn't realize it. I turned, 21. Thankfully, my hospital let me stay with my surgeon until I was 21 because of the extra complications of my bilateral cleft lip and palate. When one of the differences is when I was managed by the pediatric team, they contacted my family instead of me, of course. As an adult, I don't really know where to go. I didn't really know where to go or who to ask or make sure that my insurance would cover it. I only specifically want to stay with my surgeon because I've known him since I was very, very little, and I only trust him. And that would be the only way that I would join an adult team.
So, Elena, what you're saying is that you went from a team that planned your visits, your appointments, to all of a sudden moving on to finding your own places and your own providers.
Yes.
Okay, that's great.
And it's hard as an adult. It is. You have to learn so much.
Okay. So why do I have to leave the team? Okay. Well, as Elena said, well, because I was booted out at 21. And I think that's a pretty good sense. But, it also makes sense to leave. And as we talked about the differences between the pediatric team and the adult team, it makes sense to move on. Okay. But you also, when you get older, you have different needs and wants, and you have to find the providers who can respond to those healthcare needs. And so it is important that you leave, and that even if an adult cleft team is available, you'll transition to an adult approach for your care within the practice. And no matter how you slice it and dice it, you're going to have to move on. Okay. I think that when we think about transition of care, I think we have to think about a number of things. We have to understand the transition happens. Okay, it does happen. Even if we don't want it to, it does happen. There are challenges. It is a challenge for providers and parents and young adults to experience this transition or even being introduced to it. You've got to shift your thoughts, okay, from and actions, and to include what that young adult wants. We're going from, deciding for a child what he or she, maybe should have, to now what this young adult wants. And we have to empower them, okay, to support themselves and to get the help they need and to feel confident about it. And that above and beyond anything, our goal is always, always to improve and enhance quality of life. And that's why a successful transition program, I think, can foster that. Okay. And why is it important? It's important because we want to make sure that healthcare continues. We don't want a treatment gap, and oftentimes that happens. We want to prevent poor outcomes. If we don't have continuity of care, I think that outcomes as an adult may not be optimal. And I think, as I said before, to ensure quality of care, and quite frankly, if a transition is good and you have the providers you need, you're going to reduce healthcare costs. Very important. And like I said, I think the essence of transition of care is that it is patient-centered, it's whole care, and there are choices to be made. We collaborate. It's ongoing, and we want to make sure that it's a good and solid well-being for this person, right? Okay. There are keys to transition, and this is, I think, really important, is that we have to embrace it. But I think that a real critical key to this transition is the psychosocial providers in the process. Elena brought that up to us during our discussions, and how important it is to include the team psychologist, the team social worker. They're very instrumental because it can be stressful, it can be challenging, and we need to help them through this and answer questions. We have to always balance, the participation with that young adult, that parent, and the team provider. It's a balance, and sometimes the balance shifts one way or the other, but we try to maintain it. And then again, as always, patient-centeredness. Okay. We have provided a handout with some tips, okay, for the parents and caregivers, but I think that 3 tips that I'd like to focus on is that transition has to be initiated early. So please, as caregivers, start talking earlier than later. I think it's important to teach your child skills, and we'll talk about some of those skills that will enable them to manage successfully on their own. And it's going to be very, very important to be open to them and listen. Listen, as parents, often we don't want to hear things. It can be difficult, but it's important to take a little step back and just be open and listen to your young person. Okay, as I said, expect some stress, understand challenges of change. For anything that we do, change is not always easy. And I think that we have to recognize, really importantly, how roles will change. You have been such dedicated caregivers, and you have been an overseer of care for years, and you have been supportive. But now it's time to shift from that overseer of care to one of guidance and support and reassurance. So it is shifting gears. And like I said, it's not always easy, and we recognize that, but you'll do it. You'll get it done. It will work, I promise. Brenda, where do we go from here now?
That's a good question. So, we've heard about the differences between adult and child care, what's required, but this really gets down to the nitty-gritty of where we in the moment and where we're going to the future. So Linda and I are passionate about the field, and we noticed that there was actually very little on transition of care happening for individuals with cleft lip and palate and craniofacial differences, and we really want people to understand the importance of this. So we developed a model and on the transition of care. And as Linda said, we have to change gears. So we decided that, as she's been explaining, it is a process, but it is a journey. It's a life's journey, as you saw those beautiful pictures of Elena earlier on. So we decided to use a roadmap and break our journey into 3 phases. And that is the preparation, in which we all know planning for a trip and the anticipation is fun. And then the actual journey of getting from point A to B, and then the arrival, which in tonight's case is independent and person-centered adult care. And as Elena's pictures showed, and this graph does too, we know that cleft care is a lifelong process. And the question arises, but if we're talking about transition of care, when should it start? So the optimal time is between 12 to 14 years, which is young, but in time to be able to start. And so, in real life, we have AAA, right, for roadside assistance. But in transition of care, we had to think of some specific points as well. So we have to prepare to manage your care and life independently. And that's, like we said, there's going to be support all the way to be able to do this. But young adults need to also develop knowledge and skills to understand and independently manage their healthcare needs. So and we will go through the process step by step in the next couple of slides. And then you have to learn skills to advocate for yourself, because that's where you're taking over from parents. And then, very importantly, be able to find new providers, because like Elena said earlier on, she didn't know where to begin. And this is something that we'd like to throw out there and give some thoughts on how we can go about doing that. So getting there needs preparation, like we said earlier on. And it's really important, like we said, to start early, and that is by having conversations, parents with their children, but very importantly, to involve the team. So we would want to know whether the team has a transition plan and whether they have a person designated to oversee the transition, or in which way they can really assist. And as we said earlier, there has to be a balance between parents allowing young adults to start taking charge, but also to support them. So we want the young adults to be independent and be involved in the discussion. And again, a big responsibility for young people, because you have to know your own story. We know you know your own story, but can you share that story with others in a meaningful way, because this is part of your self-advocacy as well. And then you have to be bold and be able to take charge, because kind of like the Nike ad, just do it. And then you have to be really active in finding those community providers. And we learned a lot from Elena in practicing for tonight on how she went through the process. So in terms of ages, like we said, we've got to start early, and then we talk about transition readiness. So are there little steps that we can have these young individuals do? And for instance, making own appointments or being part of the conversation. Linda will address that in a minute. Then the transition planning starts. What are goals? Where are we going with this? And then what's really important between the ages of 14 to 18, the plan has to start coming or to fruition in action so that we can identify those providers. And when the pediatric team care comes to an end, the young adult can move on. And that optimal age for transition to have taken place is between 18 to 20 years, where there are providers either in an adult team or in the community who can work with you further.
So, Elena, I've got 3 questions for you. Okay. One, was it challenging transitioning from pediatric team to an adult service?
Yes, it was. Because I was really stubborn when I was younger. I'm still stubborn. That hasn't changed. But I was still stubborn when I was younger, and my parents, they tried to foster independence in me, but I did everything that I could to avoid doing anything that they said for me to do, such as making phone calls for appointments. I would draw it out for as long as I could until they had no choice where they had to make the appointment. And I what wasn't a concern as a child is now a concern being an adult, realizing that I want an adult team. So an example is both my nostrils are 2 different sizes. The left nostril is a lot smaller. Therefore, I'm having a lot of trouble breathing through it. I never really paid attention to that as a child or even a teenager. That was the last thing on my mind. But now that I've gotten older, I'm 28 years old. That is something that I want fixed. Of course, transitioning, you have to worry about insurance. When I turned 26, I'm off of my parents' insurance. So now I have to worry about whether the surgery is cosmetic, which would be, I'm hoping, it would be cosmetic without the adult team, but hopefully with an adult team, they would consider it medically necessary, and that's very important. And it would be.
Speaking of that, then, wait a minute, I've got another question for you. Okay. So you're talking about that adult provider. Okay. So was there an adult team available for you, or did you have to seek out your community providers? And it sounds like you were seeking out some community providers. Am I right?
Yeah, my team referred me to a doctor who specialized in transitional care, and was trying to set me up at another hospital, but I was not thrilled with this idea. It goes back to me being stubborn and not willing to do that. So now I am facing the consequence, and I need to find my own provider.
So you're saying take advantage of that transition team when it's available?
Yeah, and start early. Whether or not that child is stubborn, you keep on trying.
And tell me,
each child is different.
Tell us, who is your support?
My parents. They have always been there for me, and they're my best friends. They are still supportive of me. They still help me. Thankfully, my mom knows a lot about insurance. She worked in insurance, so I can ask her a bunch of questions, and she most likely knows it. And my dad is an encyclopedia and a calculator. So they organized everything when I was a child. They made sure that my surgery went well, made sure that even my surgeries were during like spring break or winter break, so that I wouldn't miss school, which I really hated because I love missing school. But yeah, they have never stopped supporting me.
That is fantastic. And I know your parents, they're wonderful, wonderful people.
Yes, they are.
So let's figure out some things here. Okay, you kind of alluded to being independent and what your parents asked you to do, wanted you to do. So let's figure this out. Okay, first of all, I think that they really tried to make healthcare a priority for you, and you need to do that now for yourself, right?
Mm-hmm.
And that, but because your parents are so supportive, you're being able to ask for help when you need it, and parents, and maybe some community providers. As Brenda talked about, sharing your information in your life goals, and becoming an effective self-advocate. So, moving on to what you needed to do, okay, is that you have to know as a young adult that, and parents need to know that that person is going to be involved in the conversation. And so you have to know what appointment you need to make. You have, and what your needs are, you have to make that appointment, even if it's difficult. All right. And sometimes what might make making the appointment a bit easier is if you think about what you want and you need before the visit, and you prepare a list of questions, before you go, and even do a mock discussion. So if you, I think, prepare ahead of time, you know what you need, you're comfortable with that, I think that making the appointment might just be a little bit easier. Okay. So what are the responsibilities of the young person at the appointments? Well, check in the appointment yourself. It's okay to have a parent nearby, but it would be really nice to say, "Hi, my name's Linda, and I'm here for my appointment." Always sit near the provider. And I know as a clinician, I really make sure that if a parent sits near me, I ask them to swap seats with the child so that we're next to each other and communicating. Okay, make sure you can describe your facial differences and your needs and your goals. You told me that your surgeon always would ask you what your needs and your goals were. Okay, don't forget, no question is ever too trivial. Ask it and ask away.
Can I say that my mom would always make me or have me write questions for the doctor? And yeah,
that's excellent.
Yeah,
excellent. Write them down and bring them on a piece of paper.
Mm-hmm.
Make sure your provider listens. Okay, it's really important. And if you're not sure that provider's listening, keep talking. All right, keep talking. Okay, and if you don't know an answer to a question that the provider is asking you, it is absolutely okay to refer to that parent. We all need our help. And know that an interpreter may help, and an interpreter certainly may be a different language. But what sometimes I think of as an interpreter is somebody is asking a question and you're not sure what they're asking. And so that person next to you, your parent, or your source of support will say, "Oh, I think this is what they might be talking about." So it helps. Having a second pair of ears never hurts. Okay. So, again, some suggestions, and think about it in terms of a structure and function and your psychosocial. So when you're thinking about your concerns and your wants and needs, maybe even parcel them out as structure, what's important, my nose, my lip. Function, is it my speech, eating? Is it my breathing, to your point, Elena? And do you have some concerns about school, entering a different social situation, those sort of things? Okay, so I guess that leaves us, Brenda. If I'm telling you to separate them into structure and function, how do you keep track of all of this? Huh?
Yeah. And then life happens, and like sticky note boards don't keep the sticky notes sticking. So, Yelena, do you want to share how your parents helped you keep track?
Okay, so my these are a list of all my surgeries. There's 33 of them. And my mom has every details of every single surgery that I've had, what doctor did them, what date, and actually some of the reasons why I had that surgery. But
That's
yeah,
excellent.
so my mom kept it in her wallet all the time. She also does that with my medication too.
And so
Wonderful.
this is one thing. What else?
Right. So there is the slogan that says keep it simple. And, there are 3 sentences in which you can have this information at your fingertips. And one is to think of what is your age, your diagnosis. Do you have, for instance, a repaired bilateral cleft lip and palate, and what is a brief medical history. And then you can go to what your treatment plan was, and then also, very importantly, just to say what your questions or concerns are that you want to talk to during this visit. So that's kind of a short way of doing it, but we have come up with something fun, Linda and I, and this is the next step in our journey of transition of care. So we thought it would be really great for individuals to have something like a cleft palate passport. And this is just an idea that you could have this information together. So we kind of borrowing a little from Elena's mom, who had all that info right there, but we just want to package it into a little tighter passport, and maybe for some, to have on your phone or on a tablet, or even in a hard copy, with things like identifying information, your name, your diagnosis, things like medication. Elena was saying that as well, but for instance, if there's something really important like asthma medication, and then there are the surgery dates, and really important is what is practical information, like certain telephone numbers, dentist, primary care physician, etc. And then 2 checklists, of course, are of great help. So we will have a draft of something too that we're working on my face. And that is, we gave careful thought to that and thinking of different things that you would want to know, sort of skills in terms of general information, like now I'm older than 18, but do I really know what my rights are? So, and then to think of it, do I know that? And then secondly, maybe I need to learn more about this. So yeah, this is important, but I really don't have the information at my fingertips. And then thirdly is we want to say, man, do I need somebody to help me with this? So we have a draft of a questionnaire, checklist that we put up and that we think could be really helpful. And for instance, to say about things like my health specifically, can you actually share what your diagnosis is? And then I know this, so we can check that box. But do I know how to access or get access to my medical records? So maybe not, and how do I find out? So right now, back to the journey. I started talking about the differences between pediatric and adult care. And on the graph, you will see a gap, but that's really what our whole presentation is about tonight, and that is to not have a gap. So to have this fluent transition of care, and whether it's in the same system or setting, so that you can get to patient-centered care in a multidisciplinary team, or whether you have to go outside, but that it really is a seamless transition. And again, bear in mind that little sports car that was on the journey and traveling to the end destination. So here we are, and these are just really important parts of doing this journey. And for instance, we said that Linda's talked about how you can call, making appointments, asking questions. We know that's difficult, that Elena shared. But then too, a next step in this is, how do you complete forms, health forms or application forms for employment? And fortunately, there are parents to be able to help you and show you the way initially. And that's a good starting point. And then also you would have to become accustomed to signing authorization forms. And that actually means that you need to read before you sign, because this now is becoming really important and a big responsibility. And then you have to understand medical and dental insurance. Elena was so fortunate to have a mom that knows this, because even adults and older adults like us find it difficult to figure out at times. So that's one of the things on the checklist again is, do I understand this? Do I need to know more? Where can I get help? And then very importantly too is understanding your legal rights, because as a young adult, you will be the one signing consent and giving in permission for all kinds of sharing of information. And then finally, advocating for yourself, because that's really empowering. If you can be in control of how you want to meet your needs and goals. So, Linda?
Here we are. So I think what's really important along this journey is to know what you need and what you want. Okay. And I think that's really important. And I think Elena talked about that. For her, it's breathing. So she knows what she wants. And it's important for that young adult to do that. I think that to search for that provider. And if you need to, you contact the pediatric team for names and numbers of community providers. Use them as a resource. Yes, you may not be seeing them on the team anymore for that routine visit, but gosh darn it, they can be a valuable resource. I think that, again, we're not going to, belabor this, but I think to explore the insurance, and not just medical and dental, but for mental health services. I mean, that's really very important. And accessing treatment. Now, be aware that not every provider is aware of cleft lip and palate. And so those are the questions you're going to have to ask that provider. How familiar are you? That's why knowing your story is important. How familiar are you with this? And if they say not very, you have your choices. Well, you can teach them about this, or they might want to access resources for themselves, or you might just simply say, as we all might do, thank you. You've been really very kind, but I'm going to try to find somebody who has a more specialty in this. That's okay to say. And that's part of self-advocacy. All right, next. Let's see. We talked about this, scheduling the appointments. When you make them, follow through. I think that these are points that we talked about before. How to contact the providers, follow through on that appointment, and develop skills to self-advocate. Really important. Next one. There are going to be some individuals for whom this might be a challenge. Okay. And so this caretaker takes on a more prominent role. Okay. So there are tools that are available to assess transitional readiness. And that parent or the caregiver may have to be a proxy to make some medical decisions. All along, we've been talking about self-advocacy, but there are certain situations where that might be a little more challenging. So it'll be important to work on the long-term needs. So you might have a caregiver might be more familiar with those long-term needs are medically, dentally. And so, but you know what? By no means does this mean that the caretaker takes over. When it's appropriate and when it works out, involve your young adult in the decision making, no matter how much of a role they want to play. It can be big, it can be little, it doesn't matter. Involve them, make them part of your team. And to establish those healthcare supports, maybe you will have to go beyond just medical, surgical, but again, those psychosocial issues, social work, those teams. And finally, how do we know we've gotten there? We've prepared, we've gone on this journey, and now have we arrived? And how do we measure transition success? The truth is, no one really knows yet. Okay, successful transition is complex and it's individual, and so we don't know yet. But I think that the really neat thing about all of this is the Eunice Kennedy Shriver National Institute of Health and Development. This organization, this group, this institution has made it their goal to improve measurement for transition of care. And it is a priority. And I'm just thrilled to know that it is. Okay. So I think that what we need to do to take a look and measure success, we have to look at healthcare outcomes. We will have to follow these young adults to see how successful they've been and what their satisfaction of care was. What they thought was, quality of life for them. And so what were their challenges? We need to know what their challenges are in getting there. And we need then to be astute enough to recognize those challenges and then try to help them through the challenges or to make things better for the individuals who are going through transition of care. So we're going to have to look at care delivery. In England, they have made transition care and adult care, under one umbrella. I'd love to see that happen here. Okay. So yeah, we have our work cut out for us. We can do so many wonderful things, and I think we're on our way and we're making that journey, but we still have more places to go. And then what I'd like to do is to just hear from Elena one more time. And so, one, how did you navigate transition of care? And do you feel that you can advocate for yourself and the services you need?
Well, how did I navigate transition of care? Like I said before, my mom really helped me, still makes a big part in everything. If I have any questions, I go to her, honestly. But also looking on the insurance websites, that really helps on finding providers nearby you.
Good.
And that cover you, or that your insurance covers.
So you're actively going after it, right?
Yeah. Even though I'm a pro at procrastinating, but I'm 28 and now I'm just kind of starting to realize that I kind of need to grow up and move forward and transition into adulthood. But I would definitely say that by helping your child introduce your child to transitioning of care young, and don't stop even if they don't want to hear about it. Just try to work with them, and everything that you have said, try to do that.
And Elena, I got to tell you, I think you've done a phenomenal job.
Thank
I really
you.
do. And can you self-advocate?
Yes.
That's it. All right. Excellent.
Thank you.
So to wrap up, our transition of care was this exciting journey that we hope it will be for you, because yesterday is when we needed to start preparing and thinking about immediate concerns, but also where we're going to. And then today was really the transition itself and moving on. So getting that plan in place, seeing whether you can stay in the same facility, transitioning to an adult team, or to be able to go out into the community like Elena did. And tomorrow, Linda?
And tomorrow, let's get there. Let's reach our goals. Let's get the outcomes that we want. And let's just overcome any challenges. Okay, we've got to work together as healthcare providers, families, and the young adults. I think that makes the team. And I think we'll arrive, and we'll arrive safely, and it will be great. That's it. Thank you, everyone. Yes.
Oh, thank you so much for having me on.
Thank you, Elena. Thank you, Linda and Brenda. This was really, really terrific. Great presentation, very optimistic, positive, and I think it gave us a lot to think about. Let's take a few questions. If you have a question, please enter it into the chat in YouTube or Facebook. Let's try to make those questions be general in nature, and the answers will then be general in nature. But let's start with a question that we have from our audience. As a high school speech language pathologist, I know transition is a goal area in the IEP. Have you found success working with schools to help individuals learn advocacy skills for transition of care?
Brenda, do you want to take this one?
No, I think you start and I'll chime in.
Okay. Boy, I love the fact. This is a wonderful question, and kudos to you for putting it into the IEP and making it a goal. I am thrilled to hear that. And the interesting thing is that I have not communicated with the schools to help them, and I'm not so sure how many teams are actually doing that. So this is an idea that should come to be a plan. And I'd love to hear more about what you're doing in terms of the IEPs. I think that this should be included in that program. So bravo. I'm delighted you mentioned that.
Yeah, that's a very, very interesting concept to think about, and from my face to think about how can we support that for sure. Here is a really interesting question. I am a parent, and my child is a young adult now, but I'm having trouble letting go of trying to manage his ongoing healthcare needs. Do you have any suggestions that might help me to let go of the desire to control this process and trust him to take care of himself?
Big steps, huh?
Yeah. I mean, isn't that something of all parents have problems with? But I think specifically, and in, this case, it would be a good idea too to consult the social worker and the psychologist on the team, wouldn't you say, Linda?
I would.
As a starting point. And also, sort of doing a bit of self-reflection and thinking of why you're having this problem and challenges. And with parenting, it's always good to involve the child directly or the young person. So, to have an open discussion. Could you contribute, Linda?
Yeah, and I think it's fair to say to your child and to be open and honest and say, you know what, I'm scared too. It's hard for me to let go and acknowledge it. And then maybe, and we've seen this in our children, don't be afraid. We'll do this together. And I think that's really important. So share your own, concerns, just like you did before.
I agree. I really agree that knowing that your parent is on your side and feel a similar way. I didn't ever realize that it might have been hard on parents, but
to acknowledge it, as
definitely.
a parent, and then I think you can move forward.
Yes.
Great, thank you. Elena, this is a question maybe you can help with. This is think a little bit ahead of someone who didn't quite have the care or the support you had. This is an adult patient, but they never really learned how to advocate for their own healthcare needs. What suggestions do you have for me at this later stage in life that might help me move forward in a better way to get better care?
Again, could you just say that again, please?
So this is somebody who never really had somebody advocating for them, and now they're at a place where they want to advocate for themselves. What ideas, Brenda and Linda also would love to hear from you. What ideas do you have about how they might better advocate for themselves?
Well, definitely one thing that you can do is start by baby step. Start making phone calls for yourself. Definitely knowing what you're calling for and what your needs and demands are. That's very important. And make sure you have a list of everything. And then one of the things that is kind of difficult is finding the providers around you that are covered by your insurance. And so, like I had said before, go onto your insurance's website and see if they offer a list of providers that are in your area.
I think so. And support groups, they're available.
Oh,
yeah. You think
definitely.
So?
And definitely like the psychosocial services. I really do think that talking to a therapist is very, I think it's a smart idea. And because if you, they are there to help you.
And they can guide you.
Yes.
Yeah, good.
Yeah.
Yeah, no, and I'm curious actually, Brenda and Linda, the American Cleft Palate Craniofacial Association has the comprehensive care teams, and you can go look up those teams through either the MyFace site or through their site. But how do you find those are pediatric teams? Is there a list? Is there some way to find the adult care teams?
Brenda, go for it.
Well, again, thank you so much for inviting us for tonight, because not only did we learn from Elena, but we have had brilliant ideas for further research. So that is something that we've actually been thinking about for a while too, because we've experienced this in doing our own research to start up a directory with adult teams, because you do go to websites and it says that they provide services across the lifespan, but then it doesn't give you information whether there is any transition of care or real adult services. So Stephanie, this is a burning question and something that we plan to address, in research and as members of ACPA as well. So
I think
thank you.
we have a project ahead of us.
We do, but like I said, and thank you to MyFace, because you made us think.
May I say something real quick?
Absolutely.
Okay. It would be really, really nice to know that a transition of care exists, so that you don't have to have that gap in between, from me 21 to 28. That's a big gap. So it would have been nice to know that I could go into adult care.
And have that list right there for you.
Yes, yes. And especially everybody already knows me. I don't have to list everything about me, and, they know my history. And it would be a nice relief, being able to work, especially with my surgeon. So that, because he's the only one that I trust.
Elena, we will get to that. I can guarantee you this conversation has been really amazing. I want to thank Brenda, Linda, Elena for coming on today and for talking about this really important subject that clearly we have a lot more work to do, for sure. I do want to apologize to all of you that we can't get to all of the questions, but if you'd like to send us your questions, please do so at info@myface.org. Because craniofacial differences impact the body and the spirit so significantly, as you heard tonight, MyFace provides important direct services such as access to patient and family support groups, as Elena talked about, topic-driven workshops, and online programs that serve to educate as well as entertain. These programs aim to offer guidance, resources, and a supportive environment for all of those who participate. MyFace also hosts unique networking programs that seek to bring the community together. We want to empower the spirit and build strength and let families across the nation know that you are not alone. For more information about our programs and services, please visit us at myface.org. And I want to let you know that in a couple of weeks, we're going to be hosting the next MyFace, My Story podcast episode titled Finding Joy in Your Journey, Growing Up with a Cleft or Facial Difference, that will be presented on Wednesday, May 11th at 6 p.m. Eastern Time. To register, visit myface.org/mystory. And please look out for an email to register for our next Transforming Lives webinar program entitled Preparing Teenagers for Orthognathic Surgery, which is jaw surgery. To register for this, please visit myface.org/surgery webinar. And finally, we want to let you know that on Monday, this coming Monday, May 2nd at 6 p.m. Eastern Time, we will have MyFace Celebrates. This is an exciting event where you'll see music, performances, storytelling, and it'll be a benefit to raise money for the craniofacial community. You can participate either live in New York City by joining us in New York City, or you can participate virtually. To register online, please go to myfacecelebrates.org. At MyFace, we strive to provide the most helpful and informative resources. To help us do so, we ask that you take a moment to complete our brief survey by visiting myface.org/myface.org/transition survey and let us know your thoughts. We have also provided this information in the reminder email that you will receive. Again, I want to thank you all for joining us for this program tonight, and have a wonderful evening.